Hello, everybody. We are back again, and today we are back on the occasion of Children's Day. Uh, Nobody else better for this particular day but a pediatric dentist for this particular occasion. So, here we are having today Dr. Chandan from Bangalore. Dr. Chandan is a professor of pediatric dentistry at VS Dental College and Hospital. He's got about more than 2 decades of clinical experience and teaching, and also in research. Presently, he also serves as a postgraduate guide and examiner with multiple publications to his contribution. So please welcome Dr. Chandan. Hello, doctor. How are you?
Hi Amol, I'm good.
Thank you for taking your time for this short question and answer session which we are having. So we'll directly come to the session and start with the question and answers. We won't take much of your time today. All right. So my first question, which even you would be encountering a lot in your everyday dental practice, when should a child's first dental visit be in at a pediatric dentist?
Okay, any parent, the first dental appointment would be either the first teeth which erupts in the baby's mouth or
Right.
first year's birthday. So first year of the child's age.
Right.
So whichever
Right.
comes first, you got to that should be the first day of first appointment of the child.
Right. Any particular significance? I mean, can you elaborate a little bit more on this particular
See, more
point?
the anxious parents for teething, how to brush, diet, and sensitization of the baby for the future oral hygiene practices. So this makes a very ideal time for them to start the oral hygiene practices, as in brushing or cleaning teeth, or sensitizing. Basically, something goes foreign body in the oral cavity other than the feeding thing. So child has to be sensitized to initiate a better oral hygiene practice.
How do you prevent caries in child's teeth? We definitely have heard a lot of talk about preventing caries in adult teeth, but any special, or any different thing that you would recommend from your end with your rich experience, for anything different has to be done for children's teeth?
As we all know that the parents, they want their child to be healthy. So the number of times feeding comes into picture. Now,
right.
Always make sure that there is a gap of 3 hours in between each meal, and no food
Right.
should be sticking on the teeth.
Right.
So whatever you feed, make sure that it is not there sticking on the teeth, and keep the feeding time as crisp as possible, not more than half an hour.
Next question. What would you recommend about the gaps which are visible in children's teeth when there's too much of a gap in between the eruption pattern of your permanent teeth and the falling off of your milk teeth? How do you? We get a lot of concerned parents rushing to us. The gaps are too big. And they rush to us. What do you do about these gaps? Will these gaps ever be closed? And the parents immediately hit the panic button. So what's your take on that particular point?
See, gaps. We see gaps in between teeth in two issues. One is the milk teeth,
Right.
and parent has to be very lucky that if their child has got gaps in between the milk teeth, they are lucky.
Right. Absolutely. I agree with you on that. Yes.
Yeah, because the bigger teeth, the permanent teeth, are much bigger than the milk teeth, the baby teeth. So they should have extra space to accommodate it. So gaps in milk teeth is amazing. That's very ideal to have.
Right.
Now, during the transition time, the gaps in between teeth is, it's an adaptive phase. Not to bother about it. And from the 8 years to 13 years of age, approximately, it's called as the ugly duckling stage.
Absolutely.
So you parent Anxiety is common, so not to worry, it's going to go. Every teeth which erupts onto the oral cavity takes support of the existing permanent teeth. So it
Absolutely.
leans on to the adjacent teeth, which is already there. So,
Right.
it's a supporting, counter force where it tilts but it corrects it by itself. It's a self-correcting anomaly. Gaps in between growing teeth within 13 years is a self-correcting anomaly. Means you don't have to bother about it. No treatment is necessary for it. So
Right.
it corrects by itself. So you just have to keep it monitoring with your dentist, whoever is there, so that they know what is happening around. So there
Right.
is an easy way or space for sufficient space for the permanent teeth to erupt in the oral cavity. That's
Right.
it.
So bottom line is there's no reason for the parents to hit a panic button over
You
there
don't you
when
don't
they see
have
the
to
gaps. Absolutely.
until unless uh, there is no cavities, there is
Right.
no multiple teeth called supernumerary teeth or additional teeth or
Right.
supplementary teeth. Then you've got
Right.
to best practice is at the age of 6 years we got to get one radiograph done called orthopentamogram or OPG in common
Right.
ultrasound purity. So that will show up any kind of additional teeth or any kind of anomalies, problems associated with eruptions. So we anticipate any issues much before, and it sorts out the problem.
Another typical question you would be encountering, it's about habits like thumb sucking or overuse, prolonged use of the pacifier, or even bottle feeding. What would your insights be, inputs be on that particular front?
Thumb sucking is
How harmful are they? And yeah, go ahead.
none. Both of them are not harmful in case if it is not used prolonged more than 4 years of their
Right.
child's life. So up
Right.
to age of 4 years, thumb sucking is considered normal. Among the working parents, it would be more because the baby would be missing the mother feeding
Right.
practices. That is, it acts like a pacifier.
Right.
So up to it, it's totally behavior onto it, and any kind of adverse effects like intensity, the pressure of the habit, and the duration of the habit, it also has to be assessed. So
Right.
up to age of 4 years, we consider it as pretty normal, provided the intensity is less. And once after, if the baby is around more than 4 years and they are having latched on to the habit, then we have to work on something called as habit breaking appliances and therapies.
Right. Right. Right.
Then pacifiers is again. So you got to mind on as far as possible up to 2 years, pacifiers are okay. After 2 years, switch on to sippers as well as
Okay. Okay.
the adult eating utensils or cutlery onto it.
Okay.
That's that. Not to prolong pacifiers more than 2 years.
Next question. What is the cause of early childhood caries or cavities, which you typically see in a lot of younger children, which I actually see a lot in the newer, the newer children nowadays, which is actually alarming. So I would really like your inputs on this to make the parents aware as to this needs to be addressed at the right time.
Early childhood caries or ECC is one of the largest or disease among the oral diseases,
Right.
rather than any diseases, because of
Yes,
the
absolutely.
number of teeth involved is like tremendous. Like most of 80% of the teeth are involved, and that is because of the diet what we have been providing to the child and the hygiene practices onto the refined carbohydrates, which it's an easy food and easy energy giving food.
Biggest
So
culprits, yes.
yes, so it's not only sugar, any kind of carbohydrates, even rotis, bread, rice would cause cavities provided it is there on the teeth for a longer time. Our teeth in the oral cavity, there is something called as demineralization and remineralization which happens. So we eat food and the food digests, and during the digestion of food, there is a lot of acids which are released. There are several acids which are released. Now,
Right.
oral cavity being as a neutral pH, what happens is the acid pH reduces and the enamel starts dissolving if in the presence of this acid. Now, that is because of these refined carbohydrates being sticking on the teeth for a long time and beyond the time of supersaturation from the saliva. So, baby is eating breakfast for 1 hour, then again brunch, continued by brunch, again continued later by lunch. Then it's a vicious cycle of eating because it's easily available for them. So, parents has to mind their timing of feeding their children and what they are feeding. Stick on to as far as possible fibers, fruits would be best snacks for the boxes for the school-going children. Not on processed, and cut down sugar as far as possible.
Right.
And supported by clearance of these food by brushing. It's like using our hand or plate. As soon as we eat food, we wash it, so clear it off.
Right.
So that it's easy. So the increasing the frequency of brushing, it is always best practice is 2 times a day. Doesn't mean that you cannot do more times. If you are feeding more, brush them more.
Absolutely.
Feed them less. So making sure there is no food sticking on the teeth is the prime reason, and sugar exposure or refined carbohydrate exposures is the main culprit of early childhood caries.
Let's move away from cavities and let's talk about sports injuries. So a lot of impetus is given by parents nowadays to indulge their children in sporting activities, and all sporting activities come with their natural share of injuries, falling down, So dental sports related injuries typically among children, what would your advice be for parents on that front?
Any injury to the oral cavity, first assess the degree of damage. The window period is just 1 hour.
Right.
Even though the permanent teeth falls off, we can reimplant it.
Absolutely.
We can fix it back. If the teeth is half broken, get the broken piece as soon as possible to the nearest dentist. They can fix it back, called biological restoration. We can fix back the same portion of broken teeth, and make sure that in case the teeth is fallen off from the socket or the jaw, to store it in either on a neutral pH like milk without sugar, just plain milk, or tender coconut, whichever is available. Milk is very easily available everywhere. So just put it inside it and carry it to inform your dentist about the injury so that they are ready to reimplant it. And it's a simple procedure onto it, sophisticated procedure, but the teeth lives. But it has to be attained in this golden hour of 1 hour.
Yes, the first 1 hour, absolutely.
Yes, 1 hour is very important onto it. So make sure that your sports people or the coaches or the teachers in school, they're aware of that. We can get it fixed onto it. That's the best way to, reimplant or have best prognosis of any treatment from us would be only if in case the child comes early.
Perfect. I think we have addressed most of the initial preliminary questions that we encounter. Let's come back again with more in-depth questions, with in-depth solutions for our parents. Thank you very much for your valuable time, and hope to meet you again for another session very soon.